Hi, Amanda.
Hi, how are you, Dr. Ortiz?
Oh, look at you. How are you?
I look a little different than the last time you saw me.
Manabagan! What have you done with yourself?
What have you done for me?
Where is the rest of you?
Yeah,
How
life
much?
is good.
How much
Yeah.
you lost?
I'm down since I started pre-op almost 50 pounds and 10% body fat. And
Wow.
I'm
And-
to Friday, I'm going to be 4 months post-op.
Damn, you're an overachiever, girl.
I'm just doing, what I've been told to do because you know, you guys know what you're doing, like down to the letter. So if you follow it, it's a clear roadmap. You just follow it. Just
So I really want to use your feedback because obviously you're kind of like the go-to person because you're a nurse, you're knowledgeable, people trust you. uh, you know the ins and outs of medicine without actually having to be a physician because we're our minds are clouded and
uh-huh.
think so highly of ourselves that we actually handicap ourselves to be more service friendly. So has program, the video program, has that helped?
Yeah, it's so great because there's so much education and support. And just because I'm a nurse or just because someone is a physician, I know there's nurse practitioners and physician assistants that come to OCC as well. Um, doesn't mean anybody knows everything. We all can always learn something. And you guys are the experts on obesity and on weight loss surgery. And so if there's a video that you're doing or that the staff are doing, information Lucia is sending, I want to see it. I want to hear it. Because we just all the time accumulating little things that we can put into practice day to day for the long-term success.
Now, you're obviously not shy about telling people you had surgery, and has are people like noticing dramatically? Of course, right?
When I see people that I haven't seen for a while, they're like, whoa, if the wind blows, you're going to blow away. And I don't get tired of hearing that. And I still have, 30 pounds or so to get to my goal. But yeah, people are definitely noticing. And I think to be polite, a lot of people don't want to say, what did you do? But I was telling the lady before we started speaking that I just shared on Facebook, my personal Facebook last night, that I had bariatric surgery on January 28th this year at OCC. And I hadn't publicly posted that before. And I want to share with people because obesity is just, it's costing to so many people. And I want people, it's so misunderstood. And I want people to learn about it. I want people to have more understanding. I want people to open their minds to solutions that are out there for it. I want people that are suffering with obesity to not feel so down, like I'm bad, I'm this, I'm that, and see there are things they can do to save their life. When people have obesity, um, you know, everybody, we think nothing of, you need to get a knee replaced because you're crushing your joints under the weight of your body. You need to have heart bypass surgery. You need to have sleep apnea surgery. You need to wear CPAP. You need to get a fistula so you can have dialysis. That's just like nothing. We do those things, and I work in the recovery room now at a large hospital. So I'm seeing all these procedures all the time, and I've spent years recovering people from open heart surgery. And it's just like it's nothing. We just do it and do it. And I think if people get obesity more in the forefront of their mind, and weight loss surgery as the cure for obesity and the cure for metabolic syndrome that's killing millions of people around the world, then we can prevent so much suffering.
You got it, girl. And truth be told, I mean, the system is more of a disease management
Yeah.
system than
Mm-hmm.
an actual health care. If we were to care for health, we wouldn't wait till people have these different expressions of metabolic syndrome, which is high blood pressure, high blood sugar, high triglycerides, high cholesterol, sleep apnea, and all these things lead to heart attacks, lead to cancer, lead to stroke, lead to all these different diseases that are actually now not only preventable, they're curable. Talking about that, how was it with you? Were you getting close to any of, did you feel that metabolic syndrome was catching up with you? Was it just the weight? How was it with you?
No, I have diabetes. I have type 2 diabetes. I have hypertension and high cholesterol, or I had. And, I was on medication for all of those things. Before my surgery, I was starting to feel that I was developing the neuropathy where I had such pain and burning in my feet at night. It was keeping me from sleeping. I'd never had a sleep study, but I probably had sleep apnea too. And I just felt terrible. And my A1C measurement for diabetes was 7.6 before the surgery, and that's not even that terrible. It's abnormal, but it's not even that terrible. And since the surgery, even before, and I remember you telling me this, even before you lose weight, you're going to feel better. And it was almost overnight that the burning and the tingling went away in my feet, and I could sleep at night. I just had 3-month labs done, and my A1C is 6.7 instead of 7.6. My cholesterol is almost completely normal. My triglycerides are normal. My blood pressure used to be 140/90, and that was on medication. And now it's 110s over 60s. And I'm not even at my goal, so I'm just going to keep going.
So you can say you're practically cured from at
Yeah.
least two of those three,
Mhm.
and you're looking back 3 months if you look at your HbA1c, which basically, if you look at your blood sugar patterns today, you're probably normal at this point.
Yeah. Yeah. No, I never have the feelings of the burning or the sluggishness after I eat. Like, I don't. And another thing, a lot of people talk about this surgery as a tool, and that's a really great. I think that's a great way to refer to it, because it has um, it has made, like, stopped me in my tracks and forced me to prioritize myself and taking care of myself. And I needed a tool to do that, as do and pretty much every nurse does, because we're always taking care of everybody else. And so now, if I'm not planning ahead about what I'm going to eat, what I'm taking with me, um, there's not going to be an alternative around for me. There's not going to be anything I can grab quickly that is not total junk. So it has forced me to plan ahead with my shopping and my meal preparation. And so I'm doing those things, and I've been able to do it for months now. Whereas before, I'd do this fad or that fad, and it would last for a week or two or something. But I really feel like this has helped me transform my entire lifestyle. And it's gaining momentum, because the better you feel, the more you do, the more I want to go out and walk or bike or whatever. And it just all builds on itself. It's wonderful. I'm really, really grateful.
Why do you think I love what I do? I'm surrounded by beautiful women, only getting more beautiful and more healthy. So it changed your life. I mean, it
Mhm.
you were basically heading towards a life of obesity,
Mhm.
diabetes, hypertension, and with the cholesterol profile, most probably a heart attack or heart
Attack.
disease, which is
Mhm.
50% of the adult population, by the way, in the US. And
Mhm.
suddenly you invested in yourself, and now it's a new life. You're totally cured from you're not taking medications for anything, right?
I'm still, my doctor wants me to just continue on the cholesterol medicine until they check, because I think my total was just a few points over. And he said, let's just stay and recheck it in 3 months, and you're probably going to be off of it then.
All right, I'll let him do whatever he wants to do. But they're all, the recent studies have found that if you do take cholesterol medication for the next 30 years, you'll
Mhm.
probably live 3 more days. But anyways, that's another study. So now, what is a nurse like you with all this knowledge in from a country like the United States seeking surgery in Mexico. How did that happen? I mean, what's the story behind that?
I started looking into bariatric surgery because I listened to the hospital I work at is also calls itself a Center for Excellence. And I have some thoughts about that because I see these people fresh out of the OR. And so I watched the presentation for the local surgeon, fine surgeon, and then actually really got my thinking turned around about metabolic syndrome and obesity as a disease that's cured by surgery, which was a really important mental shift. And so I started looking into having surgery here, and as a hospital employee and with full insurance, it was going to cost me like 4 times what I paid to come to OCC. And so I just thought, gosh, that's kind of cost prohibitive. And at the same time, a nurse that I work with who's very well respected, at the time I was working cardiac ICU, and she trained all of us. She was like the mama nurse that taught all of us everything that we know about recovering people from open heart surgery. I know she had gone to Mexico for surgery, and she came back and she's 60 something and she's running circles around all of us at work and just feeling so good, and she's getting so skinny. And so I finally wrote her one night. I said, Rita, what did you do? She said, Google Dr. Ariel Ortiz, and then let me know if you have questions. And so I did. And once I Googled you and I read about you, I'm like, hey, this doctor's got it going on. He's got all these certifications. You've been everywhere that you want to see a surgeon has been for fellowships. You're training people all over the world. Then I start looking at OCC. I see Joint Commission International accredited. As a nurse, we all know what the Joint Commission is. That means OCC meets the same standards like a hospital in the United States for quality, safety, hygiene, minimum standard. And OCC is the only center in Mexico for bariatric surgery that is Joint Commission accredited. I just think that's very important because when people give me side eye when I talk about going to Mexico for surgery, I'm like, no, I actually know what I'm doing. And so that's a very important thing to have, but that's not your only accreditation and certification. So the more I read, the more, I saw about OCC and all of the certifications, all the accreditations, and then the safety profile. I think I'm patient 24 something. So over 24,000 surgeries, not one death, not one leak. That's amazing. I don't think that there are a lot of places that can say 0 deaths, 0 leaks. And then, so before I went there, and again, seeing how well my friend was doing, I'm feeling really great about it. And then coming to OCC was just, it just cemented everything because, first of all, Mexico, you guys are like crushing it with COVID. They were sanitizing everything. We're washing our shoes before we go in and out of the van, in and out of the hotel, in and out of the hospital. Everything was just immaculate. And the hospital was pristine. I've never, normally if something falls on a hospital floor, it's dead to me. but OCC, I think you could probably eat off of the floor in there and be fine. It was so clean and so small, and so much precision and specialty. 5, 6 rooms. So that's the most you're doing a day. So there's so much attention for all of the patients. And I felt that as a patient, so much attention. I've never gone anywhere and had so much attention for anything. And I've had a few surgeries before this for different things. And, the pharmacist is coming to talk to you, all the internal medicine doctors, the anesthesiologist, you coming to talk to me, Dr. Rodriguez or Dr. Martinez. I think I saw all the surgeons, Lucia, 2 or 3 nurses, the front desk staff. It was just, somebody's always coming to check on you. And make sure that you're having all the details, all the I's dotted, all the T's crossed. And it was amazing. And it was so fast. I couldn't believe how fast it was all over and how, I was out an hour and I was up walking and saying how I'm seeing these bariatric patients in the recovery room now, and they're in the recovery room 3 and 4 hours waiting for a room to go to. because we're in a 500 bed hospital doing, 100 surgeries of all different varieties a day. And they're doing surgeries, and there's not an open bed to put these patients in, and they're waiting down there with me, and they're not getting up and walking in the recovery room because you can't do that. They'll get run over by a gurney or something. But they're very uncomfortable and very miserable. And I know, because you have all that gas in your tummy. But as soon as I stood up, it was so much better. And I just started walking. And when I sat back down, it didn't feel good. So I just got up and kept walking. And I know that's what they need to do. And unfortunately, we're, they're sitting in bed for a couple hours, and it's not ideal. And so every time I see that, I'm glad all over again that I came to OCC and had such a great experience.
Well, I appreciate your comments, and truth be told, the situation is that when you go to a place that's highly specialized, like you were describing right now, which is us. I mean, we've been doing this for 25 years, and in fact, we're on patient 25,000 plus. Um, well, the natural progression is to increase your expertise and increase the quality of the service and the safety of the procedure. Our procedures are literally 20 minutes. That's one of the questions that we have posed online. What to expect? How long is the actual surgical procedure? I mean, we've got them on Facebook, the 360 lives. I think the last 360 live was 17 minutes of surgery.
Oh,
Um, and isn't that cool being able to go in there? You probably, as a nurse, went in there and said, "All right, let me check all the
wow.
instrumentation, all that
I
stuff."
didn't watch it until after. I could watch it now. I'm glad I didn't watch it before, just because sometimes knowing too much is
Oh,
not
yeah.
good. But
I,
yeah.
I, nurses are my best and my worst patients, but mostly, and it's interesting that I do a lot of interviews with nurses because people naturally trust you, and there's this, I want to say, tendency for nurses to come to accredited centers, and they end up at OCC. So I would say maybe 20% of our patient load are healthcare professionals, nurses, a lot of doctors. Doctors are a pain in the ass, as you know. Um, but in general, that this is why we put nurses on interviews, because I want them to say the completely naked truth about their experience. So, comparison, you having the exposure to both international now at OCC and healthcare in the US, would you say it's comparable? Are there things that are different? Did you find things that are uh, better in one place or another?
Everything that I see is better at OCC, and I'm glad that I went to OCC. And I almost feel sorry for these people that I see that are having the surgery. They're laying in bed, all these hours. They're miserable. Um, we're giving them narcotics, and then they're woozy. Then when they get to their room, they're going to be so loopy. It's hard for them to get up and walk. Um, the diet, when they're awake enough that I'm speaking with them, I'm asking them, what was your pre-op? What did you have a weight you had to lose? Did you have a pre-op plan? They're on liquids for a couple days. There's no requirement. I'm finding oftentimes for weight loss pre-op, which is a huge safety thing. And also just mentally, to start to make the mental shift that you're doing something that is going to affect how you eat for the rest of your life, and you need to prepare for it. Um, there doesn't seem to be a lot of education for them as they're preparing to go home for what to eat. Low carb. Um, some of them know that they need to be on supplements and things like that for life afterwards. But I get out the incentive spirometer and have them start doing it in the recovery room because they're with me so long, and they don't know what that is. They haven't been taught about that. It just doesn't seem like there's a lot of, of groundwork up front. And I'm not really sure how much education there is post-op, just for the groups of people that I'm seeing. And that makes me very, that makes me very sad and very concerned. And it also makes me think, I wonder if people are going to end up making their way to OCC ultimately for a revision or for something like that. When, I can see how people have these surgeries and they don't have their eyes wide open going into it, and then they have a failure, you know, a year or so out. And then I see the people coming in for the band removals with all of that. Um, so I don't see anything that makes me feel like, oh, I should have just stayed here. No,
Yeah,
no,
and
everything
it's
makes me glad I came to OCC.
it's a different system, and I can't blame the system because it's an overloaded system. And unfortunately, you're not. The system in the U.S. is not treating patients like preemptively when they're at a certain weight. You're getting the worst patient,
Yes.
sickest patient, the
Mhm.
the the probably the extreme end where even if you end up having surgery, you may lose 200 pounds, but you're still 300 pounds overweight, or 300 pounds total weight, or the diabetes is so far advanced that the impact is going to be less. And my philosophy is, why not do it sooner? Now, did you find that, like, I get a lot of patients regretting not doing it sooner? Did that happen to you?
I definitely wish I had done it sooner. It was something that I had been thinking about for a couple of years. My mother had a Roux-en-Y gastric bypass open, uh, staples like from her neck to her groin, back in 2003 in the United States. And so she had started, seeing the road I was going down. She had started talking to me about it a while ago. And at first I was like, oh, I'm not that bad. I'm not that, I put it off, put it off. It took me years before I started thinking about it myself. And when I started looking into it, having it done here, locally, it was a couple of years ago. And every time I would make the appointments to go for the consultations, and then I would cancel them, and I'd let 6 months go by, and I'd make the appointments again, and then I cancel them. And I did that a couple of times before it finally just got fed up enough. And I definitely, having gone through it now, and how OCC does make such an enormous thing seem like so easy and so painless, as painless as possible to get through. I do kick myself and wish I had done it before, but I don't spend a lot of time on that because it's, what's done is done. We're just going forward now. I'm glad I did it. And now I just want to help as many people that need to hear about it so that they can go to OCC and change their life too.
Well, we're actually expanding, and that's one of the things that I can't be doing surgery every day for the rest of my life just myself. So over
Yeah.
the years,
Right.
I've trained three other surgeons in our technique, and now we're in October. We're about to open a center which has three operating rooms, which has three times the capacity. So we'll be able to do approximately 20 surgeries, maybe a little bit more a
Yeah.
day. But the most important thing is that I don't want to lose the opportunity every time to sit down with each and every one of my patients and get to know them. I remember when I was sitting down with you, and we're discussing all this stuff, because it really is more than just uh, surgery we're offering. I believe we're offering a service. I believe we're offering a change. We're part of this miracle where there's a change in this whole lifestyle. But it starts off by a simple procedure that then turns into wellness, metabolic wellness, weight loss, and suddenly that goes hand in hand with mental wellness. And then, wow, sky's the limit. Like I just saw you right now. It's like, whoa, girl, you look incredible.
Mhm.
So
Thank you.
so so that facility, which is opening in October, is going to have full floor for bariatric surgery. But the other thing that we're definitely adding to it is full floor for plastic surgery.
Hmm.
That's one of the things I tell my patients. Really, I don't want you lingering in the, I almost lost all my excess weight and I'm kind of happy, because a lot of patients end up with loose skin or things that are not a job for the weight loss surgery. Sometimes they're a job for the exercise or the nutrition, but sometimes they are a job for plastic surgery, and that's the part of the service that we've added to it. Well, we haven't added it. It's been 5 years already, but we're now going to have it under the same roof. And that seems also getting people excited, because when I talk to them about plastic surgery, it's like, whoa, we got people making a line now outside.
Yeah, you have the whole package, and you're turning people into, what they could only dream of looking like or feeling like, a year ago or 2 years ago, 5 years ago. And you're making it possible for them. And now under one roof, it's very exciting, the new facility. I read about it. I'm real excited to see about it. I'm going to bring my husband over. We're going to come back to Tijuana and visit. And, congratulations on that. And thank you for the work that you have done and for having your heart in the work that you do. It's very apparent that you love and care for your patients as people, and helping them to have a better life. Thank
Uh,
you.
I'm so blessed to bless others. That's the most important thing. I thoroughly enjoy my job. It's so fulfilling. And with you, you're 50 pounds down in 4 months. Your diabetes has reversed. Your blood pressure has normalized. Your triglycerides and cholesterol are way well, with or without medication, and you have a new attitude towards life, and now you want to return uh, what has been given to you as a gift. Now you have this feeling that you want to spread this wellness to other people. This is like amazing, because at the end of the day, this is what we do. We don't really market hard. We just want people to know that there is an option and not to wait. And it's not as dramatic as it sounds. Yes, some systems, it might be a little bit more challenging, but with us, it's so streamlined. And last question before we go, and probably the most important question: has it changed your mental health, the way you think, the way you relate to others, your relationship in your family with your friends? Has that already
Yes.
become part of this procedure? Tell us about that.
I feel like I am not hiding myself behind this wall of fat. I feel more open, more extroverted to speak to people, to share things. People are going to think what they think, judge what they judge. I don't care. This is what it is. I have realized that I have things to share and things to contribute, because everyone has gifts to share. And so I definitely feel like I don't stay back on the sidelines and watch life. Like, I get into it and engage with people, share, and more open, and just not hiding. I feel like I used to live life on the sidelines, is the way I think of it. I just kind of, kept quiet, kept my head down, didn't want people to look at me, or speak to me, or call attention to myself, because of how I felt about my appearance, how I perceive being judged by others, how I'm sure I was judged by others, how society looks at people with obesity. So definitely that is a whole weight to lose, aside from physical fat and weight loss. That is a huge mental weight loss, and a burden. I don't think that I realized how much that was holding me back. Even something as simple as engaging with the physician that I work with, like asking a question, or speaking up about something. I I was, probably more reserved about simple things like asking a question, just because of how I was worried about being judged. And so that's great. Um, People in my life that are important to me are still the people that are your people, no matter what. So, but I definitely feel like I'm more present for them. I'm definitely, like, I'm able to keep up with my daughter and go and do things with her, and I'm just more present in life for everybody, which is good for all of us. So absolutely a huge mental impact. I used to be on medication for depression, actually. I hadn't said that before. And I'm no longer on that either. So when I started doing the pre-op diet, actually, that that turned me around early on. It has so much to do with what we're eating and chemicals and junk that we're putting in our bodies, that people think, oh, this is approved, this is that, the FDA, but it's not. You have to really know what you're doing and read and find out about food yourself. And Lucia, she's just the best. She's 5-star, amazing woman. I really, really am grateful to her as well. She's helped me so much. I can't. I mean, she. Yeah, I can't say enough good things. She's worth the cost of the surgery herself. She's really amazing, and also somebody that I can tell cares about all of us very much and works very hard to help us all have the education and tools we need to transform our own lives.
Thank,
So
and of course, yeah, Lucia. For those that are listening in, it's like she's the director of nutrition and metabolic wellness at OCC, and yeah, she's a smart girl. You would never imagine that you would find in Mexico some resources that are actually up to par and sometimes better than what you could find locally in the United States. And we definitely are trending with the new understanding of metabolic wellness and healing yourself through what you eat, through how you process from a mental standpoint, uh, where uh, your nurturing comes from, where your food comes, where your nutrition comes from. And you're just saying it. I mean, this is something that we're going to try to give you the tools, but girl, you've done it on your own right now. I mean, you're using those tools, and then suddenly you've been empowered to take it to the next level. So last question, so you're definitely public about this and you're posting online, obviously on our social media forms. If
yeah.
people want to discuss with you, can they message
Oh,
you?
yeah,
Are you
absolutely.
open to discuss?
On Facebook, yeah, I'm in the OCC support group and the weight loss support group. Mandy Saunders is my name on Facebook. Anybody can message me. I'm happy to talk with anyone that has questions. I love being in the OCC groups on Facebook. I spend a lot of time engaging with people on there, trying to offer support to people, with their questions, whether it's pre-op or post-op, when they're saying, some things maybe I don't agree with about, they don't think they need to take their supplements, or they don't think that they should use the recommended proteins. I'm like, no, 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 no. They're the best for a reason. You're going there for a reason. If you have a question about something, this isn't the place. You need to be writing the physicians, writing Lucia, just trying to offer the support that I have to offer to people as much as I can, because I have been given this gift. Now we pay it forward, because that's how we make the world a better place.
Exactly. I appreciate, Mandy, I appreciate it so much, the time you've taken out right now from your schedule to talk to us. And I so much want to support you and this endeavor in passing it on. So, one of the things that I've created is a program called the Inner Circle for OCC, and you're definitely a member of the Inner Circle. At 4 months' time, you're already an example to follow. You're an influencer, you've been empowered, you already have that knowledge that comes with being a nurse. But apart from that, you now have lived the experience and you can help out so many people to take the next right steps. And people take so long sometimes with these preconceived notions or fears that they don't really take the next right steps to wellness, and you're helping us do it. So thank you so much.
Thank you, Dr. Ortiz.
Well, we're gonna most probably give you another follow up call very soon and see how you're doing, because you're pretty close to your weight loss goal. You're probably 2 3 months away from it.
Yep. I'm
All
doing
right.
my best.